Hello everyone, I'm Dr. Dharani and this is a part of the video series that I'm making regarding step 1 exam preparation after giving my exam. Now what I'm about to say in this video is something that I wish I had known during my preparation, because this video entails the basic difference between UWorld, NBMEs and the actual exam questions. And a lot of us who have used UWorld and NBMEs as the major source for exam prep would have always wondered what the actual exam would be like. Would it be more challenging? Would it be easier? And what would the major difference be, so that we could plan our preparation accordingly. And that is what this video is about. So when I approached the exam and started doing the questions in actual step 1 exam, the one major thing that I noticed was it was very similar to free 120s compared to UWorld and NBMEs. And I gave my free 120 a day before the exam, and I'm so glad that I did, because it was really similar to the exam pattern and it kind of prepared me to approach that sort of question. One major thing is that the exam questions contain a longer vignette similar to free 120 compared to the shorter questions that we would have gotten used to in UWorld and NBMEs. And second thing, even though the questions are longer, it is much simpler and less complex compared to UWorld and NBMEs. And just like it would be in free 120s, I think during free 120 many of us would have felt that it is much simpler, and I wish the exam questions are like that. But the exam questions are actually like free 20s, less complicated. For example, in UWorld, if there's a question and if there are answers, there are a lot of things like signs, symptoms, lab investigations that would kind of match with different options. So even if we narrow it down to 2 or 3 options, we would be kind of confused as to which one to choose, because there would be like different things in the question that matches with different options. But then in actual exam, I felt it was very straightforward. Even if the question is a long one, the question would be about what are the signs, symptoms, what are the patients is facing, and then there would be a very key finding that would help us to narrow down the answer. For example, acetyl sign, and then we would know that it's gastric carcinoma. And that is why I feel like it's very important to go through these last pages of FA, where we have the summarized version of key associations. A lot of people just tend to skip it, thinking that it is what given in FA, but it is given in a way that would help us prepare for exam, just in like the key association. So if we know the key association, we would be able to narrow down the option and choose it. And third thing that I felt was that in UWorld or even in NBMEs, a lot of the times those kind of key associations would be given in a more complicated way. For example, if it's pericarditis and it's a friction rub, it would be given as a triphasic scratchy sound, and we would be wondering what that is. We would know what friction rub is, but we wouldn't know what is this triphasic scratchy sound is. But in exam, it would be more straightforward and direct, like they would give friction rub as friction rub. And even for example, we have myxoma, in which the histology is like gelatinous materials, and myxoma cells scattered in glycosaminoglycans. In UWorld, it would be a different term, like scattered cells in a mucopolysaccharide stroma, and that could get a little confusing, but I feel in the exam it would be more direct and what is given in FA. That is why the 2 things that you should keep in mind is, whenever you come across terms such as friction rub or other things, you need to know how to exactly look for it in a patient. If you're a doctor and the patient comes to you, you should know what a friction rub would sound like to diagnose that patient. So always look up such terms and know it in a practical way. And second thing is, again, doing those last few pages of FA, because even compared to the actual text FA, the key findings would have given in different sort of words. similar to what they would ask in exam. And the fourth thing is the most important thing that I wish I had really known before exam. If there are a lot of images and diagrams in UWorld and NBME that would have been given in a more diagrammatic way or animated way to help us understand the image better, but in the exam I majorly came across all these actual gross specimens, the actual specimens from patients. And that is why I would advise you, if you come across any important diagrams that are repeating in UWorld, FA and NBMEs, but they are in a diagrammatic form to make you understand, especially with gross anatomy, always search up the actual anatomical specimen and look what it actually be like, and figure out the parts from that Googled anatomical specimen. I was able to understand what the diagram was, but it was difficult for me to differentiate different parts because I was so used to knowing that diagram in a more picturesque representation. So that is something that I would advise. And so apart from it, I felt that if you read FA and if you've done UWorld, then you would be able to get the answers in the actual exam. The two sections that were kind of different was the biostat and ethics. Biostat, there were questions that were simpler, but there were also questions that had very new concepts that have not come across in FA and UWorld, but it was only like a couple of questions, and I think that's fine. And the next thing is ethics. I really felt that because I was not able to understand ethics or do UWorld questions with what I had read in FA, and I used these 100 cases book, and I would say it just tremendously changed the game for ethics for me. And it also made me really like ethics a lot because that had so much clear explanations, and you would be able to really develop your confidence in ethics if you do that book if possible. And ethics, I would advise you that while doing a question, as a person, we would feel that this is the most ethical thing, or this feels like the right thing to do, but do not go for that. Just keep your instincts aside for a second and try to remember the principles that you have actually read in the book or in these 100 cases that deals with that particular question, and then try to derive that answer from the principle rather than directly going for what you feel is right. When you do not know the principle, then it's fine, but when you do know, when you've read it, then try to derive the answer from such principles. And so these are the major things that I feel is different from UWorld and NBMEs and the actual questions. They are longer, they're definitely more simpler, and key associations are everything. So ensure that you have read or mastered all the key associations of diseases, and also you know all the images really well, or especially images that has these key association with diseases. So thank you, and I'm planning on uploading more videos regarding step 1 prep, and if you have any doubts you can comment below and I will try to answer, and you can connect with me on my socials. Thank you.